Question 1. A medical assistant is preparing to collect a blood specimen for a PT/INR test from a patient on anticoagulant therapy. Which of the following venipuncture sites should the MA avoid without specific physician approval? A. Antecubital fossa vein. B. Dorsal hand vein. C. Vein on the same side as a previous mastectomy. D. Vein in the foot. Answer: C. Vein on the same side as a previous mastectomy. This question tests knowledge of contraindications for venipuncture, a critical safety aspect of phlebotomy. The keyword avoid indicates a situation that could be harmful to the patient. Performing venipuncture on the arm on the same side as a mastectomy is contraindicated due to the risk of lymphedema, infection, or altered blood composition caused by lymphatic system disruption. For example, if a patient had a right mastectomy, the MA should choose an appropriate vein in the left arm or another approved site. Always prioritize patient safety by selecting a site free from potential complications. Question 2. During a routine physical examination, a medical assistant is asked to perform an EKG on a patient who reports having a pacemaker. Which action should the MA take regarding lead placement? A. Place leads directly over the pacemaker site as usual. B. Place leads as usual, but document the pacemaker's presence. C. Avoid placing electrodes directly over the pacemaker generator. D. Use only extremity leads and omit chest leads. Answer: C. Avoid placing electrodes directly over the pacemaker generator. This question addresses the application of EKG lead placement knowledge, specifically when encountering a medical device like a pacemaker. The key detail is the presence of a pacemaker, which is an implanted electronic device. Electrodes should never be placed directly over an implanted pacemaker because the device's electrical impulses can interfere with the EKG tracing, leading to artifacts or an inaccurate reading, and potentially cause discomfort for the patient. For instance, if the pacemaker is located in the left upper chest, the MA would adjust the V1 or V2 lead placement slightly to avoid direct contact. Always remember to slightly adjust lead placement to avoid implanted devices to ensure an accurate reading. Question 3. A medical assistant is performing spirometry on a patient. The patient repeatedly fails to maintain a tight seal around the mouthpiece, causing air leakage. What is the most appropriate initial action for the MA to take? A. Terminate the test and reschedule for another day. B. Provide clear, encouraging instructions again and demonstrate proper technique. C. Administer a bronchodilator to help the patient expand their lungs. D. Document the patient's inability to comply and send them home. Answer: B. Provide clear, encouraging instructions again and demonstrate proper technique. This question evaluates the MA's problem-solving and patient communication skills during a diagnostic procedure. The keyword repeatedly fails suggests the patient is having difficulty, not refusing to cooperate. The most appropriate initial action is to re-educate and demonstrate, as poor technique is a common reason for spirometry errors. For example, the MA should show the patient how to form a tight seal with their lips around the mouthpiece and encourage them to try again. Always remember that patient education and reassurance are crucial for obtaining accurate test results before considering more drastic measures. Question 4. A medical assistant is preparing to administer a subcutaneous injection to a patient. After preparing the site and drawing up the medication, the MA observes a small air bubble in the syringe. What is the most appropriate action for the MA to take? A. Inject the medication with the air bubble, as it is harmless subcutaneously. B. Expel the air bubble by tapping the syringe and pushing the plunger slightly. C. Discard the syringe and prepare a new one to ensure no air is injected. D. Invert the syringe and push the plunger to release the bubble into the medication bottle. Answer B. Expel the air bubble by tapping the syringe and pushing the plunger slightly. This question tests correct technique for preparing and administering injections, specifically how to handle small air bubbles. The key here is subcutaneous injection, which makes small air bubbles generally harmless, though still undesirable. The most appropriate action is to gently tap the syringe and push the plunger to expel the air bubble, ensuring accurate dosing and minimizing potential discomfort for the patient. It's not necessary to discard the entire syringe or restart the process for a small bubble. For example, ensuring all air is out of the syringe is a common step when preparing any injectable medication. Always remember to expel air bubbles from syringes before injection to ensure accurate medication delivery and patient comfort. Question 5. A medical assistant is performing an electrocardiogram, EKG, on a patient and observes significant artifact on the tracing, specifically a wandering baseline. Which of the following is the most likely cause? A. Electrical interference from nearby equipment. B. Patient muscle tremors or shivering. C. Loose or displaced electrodes. D. Too much electrolyte gel applied. Answer C. Loose or displaced electrodes. This question assesses the MA's ability to troubleshoot EKG artifacts, a common challenge in clinical practice. The specific artifact mentioned, wandering baseline, is a key clue. A wandering baseline is typically caused by poor electrode contact with the skin, often due to loose electrodes, dried gel, or patient movement, which interferes with stable signal reception. For example, if an arm electrode is not firmly attached, the baseline might drift up and down erratically. Remember, a wandering baseline often points to an issue with electrode adherence or skin preparation. Question 6. A medical assistant is preparing to administer an intramuscular, IM, injection to an adult patient. The medication is an oil-based suspension. Which of the following needle gauges is most appropriate for this type of injection? A. 25 gauge. B. 21 gauge. C. 27 gauge. D. 30 gauge. Answer B. 21 gauge. This question tests knowledge of appropriate needle selection for intramuscular injections, a common MA task. The key details are intramuscular, IM, injection, and oil-based suspension, indicating a viscous medication that requires a wider lumen to pass through easily. A 21 gauge needle has a larger diameter, smaller gauge number equals larger diameter, than 25, 27, or 30 gauge needles, making it suitable for thicker solutions or those requiring faster injection. For instance, a flu shot might use a 23 gauge, but an oil-based depot injection typically needs a 21 gauge. Always remember that thicker solutions require a lower gauge, larger diameter, needle to ensure smooth administration. Question 7. A medical assistant is instructed to schedule a patient for a colonoscopy. Which of the following describes the most important preparation step the MA must communicate to the patient? A. Restricting food and fluids for 12 hours prior to the procedure. B. Performing a clear liquid diet and bowel preparation for a specific period. C. Taking all regular medications on the day of the procedure. D. Arranging for transportation to and from the facility. Answer B. Performing a clear liquid diet and bowel preparation for a specific period. This question focuses on the critical patient education aspect for diagnostic procedures, specifically a colonoscopy. The most important preparation step for a colonoscopy is bowel cleansing, as inadequate preparation can obscure the view and necessitate rescheduling, making the procedure ineffective. A clear liquid diet and a prescribed bowel preparation regimen are essential to ensure the colon is completely empty for clear visualization. For example, not following the dietary restrictions or drinking the prep solution incorrectly would lead to leftover stool, blocking the doctor's view. Always emphasize the strict adherence to bowel prep instructions for successful colonoscopies. Question 8. A medical assistant observes another MA access a patient's medical record for a reason unrelated to patient care, even though the MA is not involved in that patient's treatment. This action violates which of the following? A. Patient Self-Determination Act. B. Good Samaritan Law. C. Health Insurance Portability and Accountability Act, HIPAA. D. Americans with Disabilities Act, ADA. Answer: C. Health Insurance Portability and Accountability Act, HIPAA. This question tests understanding of patient privacy laws, a foundational ethical and legal principle for all healthcare professionals. The key phrase "access a patient's medical record for a reason unrelated to patient care" directly points to a breach of patient confidentiality. HIPAA, the Health Insurance Portability and Accountability Act, establishes national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. For example, looking up a neighbor's medical records out of curiosity is a clear HIPAA violation. Always remember that patient information is confidential and should only be accessed on a need-to-know basis for treatment, payment, or healthcare operations. Question 9. A medical assistant is rooming a patient who reports dizziness and blurred vision. The MA takes the patient's vital signs and notes a blood pressure of 88/52 mmHg. What is the most appropriate initial action for the MA to take? A. Reassure the patient that low blood pressure is common. B. Document the findings and proceed with the appointment. C. Immediately notify the provider of the findings. D. Have the patient stand up slowly to recheck blood pressure. Answer: C. Immediately notify the provider of the findings. This question assesses critical thinking and immediate response in a potentially urgent clinical situation. The keywords dizziness and blurred vision, combined with a significantly low blood pressure, 88/52 mmHg, indicate a potential emergency or acute issue requiring prompt medical attention. Notifying the provider immediately allows for quick assessment and intervention, as these symptoms and vital signs could indicate shock or another serious condition. For instance, waiting to see if the patient feels better could delay necessary treatment. When vital signs are significantly abnormal and accompanied by concerning symptoms, always prioritize immediate communication with the provider. Question 10. Which of the following is the most accurate method for a medical assistant to obtain a temperature reading from an infant? A. Oral. B. Axillary. C. Temporal. D. Rectal. Answer: D. Rectal. This question evaluates knowledge of proper techniques for vital sign collection across different patient populations, specifically infants. The keyword "most accurate" is crucial for this demographic. While temporal and axillary temperatures are commonly used and less invasive, rectal temperature is considered the most accurate measure of core body temperature in infants and young children, especially when fever is suspected or precise measurement is needed. For example, if an infant is lethargic and warm to the touch, a rectal temperature would give the most reliable reading. Always remember that rectal temperatures provide the most accurate core body temperature for infants when clinical accuracy is paramount. Question 11. A medical assistant is preparing to assist with a minor surgical procedure. After setting up the sterile field, the MA notices a tear in the surgeon's sterile glove. What is the immediate action the MA should take? A. Cover the tear with a sterile towel. B. Alert the surgeon to the tear and assist with new glove application. C. Continue with the procedure, as it's a minor tear. D. Reglove the surgeon without breaking the sterile field. Answer: B. Alert the surgeon to the tear and assist with new glove application. This question tests critical knowledge of maintaining sterility and infection control during procedures. The key phrase, tear in the surgeon's sterile glove, indicates a breach in sterile technique, which could introduce pathogens to the surgical site. The immediate and correct action is to stop the procedure, inform the surgeon, and help them reglove, ensuring the sterile field is not compromised further. For example, continuing the procedure with a torn glove puts the patient at high risk of surgical site infection. Always address any break in sterile technique immediately to protect patient safety. Question 12. A patient calls the clinic stating they ran out of their prescribed antibiotic and needs a refill, but it's after hours. The medical assistant advises the patient to wait until morning to contact their pharmacy. This action is an example of the MA understanding which of the following? A. Patient Self-Determination Act. B. Scope of practice limitations. C. Emergency Medical Treatment and Labor Act, EMTLA. D. Professional courtesy. Answer: B. Scope of practice limitations. This question assesses the MA's understanding of their professional boundaries, a fundamental ethical and legal concept. The keyword refill for prescribed antibiotic after hours highlights a situation that requires a physician's authorization. Medical assistants cannot independently prescribe medication, renew prescriptions, or give medical advice, as these actions fall outside their scope of practice and are legally reserved for licensed providers. For example, telling a patient to just skip a dose or go to an urgent care would also be outside the MA's scope. Always remember that MAs must operate strictly within their defined scope of practice to ensure patient safety and legal compliance. Question 13. A medical assistant is collecting a urine specimen for a culture and sensitivity test. The patient has a Foley catheter in place. How should the MA obtain the specimen? A. Collect urine directly from the drainage bag. B. Disconnect the catheter from the tubing and collect from the catheter end. C. Clamp the tubing below the port, clean the port, and aspirate with a sterile syringe. D. Remove the catheter and collect a midstream clean catch sample. Answer: C. Clamp the tubing below the port, clean the port, and aspirate with a sterile syringe. This question tests specific knowledge of urine collection techniques, particularly for patients with indwelling catheters. The goal for a culture and sensitivity test is to obtain a sterile sample directly from the bladder. Collecting from the drainage bag risks contamination from urine that has been sitting, and disconnecting the catheter risks introducing bacteria. Clamping the tubing allows fresh urine to accumulate in the catheter, and aspirating from the port with a sterile syringe ensures a clean, representative sample. For example, if the MA collected from the bag, the culture might show bacteria that aren't actually causing an infection. Remember to always obtain urine for culture from the collection port of an indwelling catheter to ensure sterility. Question 14. A medical assistant is performing an EKG on an adult patient and notices significant baseline artifact, specifically 60-cycle interference. Which of the following is the most likely cause? A. Patient movement or muscle tremors. B. Electrodes are loose or have dried gel. C. Poor grounding or proximity to electrical equipment. D. Respiratory variations. Answer: C. Poor grounding or proximity to electrical equipment. This question tests the MA's ability to identify and troubleshoot specific EKG artifacts. The term 60-cycle interference is a key clue, as it refers to electrical interference from external sources, like ungrounded equipment, fluorescent lights, or other electrical devices in the room. This artifact typically appears as a thick, fuzzy baseline with regular, small spikes. For example, if the EKG machine's power cord is frayed or if a cell phone is too close, this type of interference can occur. Always check for proper grounding and eliminate nearby electrical devices when troubleshooting 60-cycle interference. Question 15. A medical assistant is educating a patient on how to collect a 24-hour urine specimen at home. Which instruction is most crucial for ensuring an accurate collection? A. Collect the first morning void of the 24-hour period. B. Refrigerate the specimen container between voids. C. Void directly into the large collection container each time. D. Discard the first void of the day and collect all subsequent voids for 24 hours. Answer: D. Discard the first void of the day and collect all subsequent voids for 24 hours. This question evaluates the MA's knowledge of proper specimen collection instructions for a 24-hour urine test, which is often tricky for patients to perform correctly. The concept is to collect all urine produced within a precise 24-hour window, beginning after the first morning void. Discarding the first morning void ensures that the 24-hour collection starts with an empty bladder time reference, and collecting all subsequent voids for exactly 24 hours captures the total output for that period. For example, if the first void at 7 a.m. is collected, it might include urine produced before the 24-hour clock actually started. Always instruct patients to discard the first void and then collect all urine for the next 24 hours to ensure an accurate timed specimen. Question 16. A medical assistant is about to administer an injection to a patient who suddenly becomes extremely anxious and states, "I might faint." What is the first action the MA should take? A. Administer the injection quickly to get it over with. B. Ask the patient to take deep breaths and distract them. C. Have the patient lie down immediately. D. Tell the patient fainting is unlikely and continue with the procedure. Answer: C. Have the patient lie down immediately. This question tests the MA's ability to recognize and respond to signs of an impending medical emergency, specifically vasovagal syncope, fainting. The keywords "extremely anxious" and "I might faint" are clear indicators of potential syncope. The first priority is patient safety, and having the patient lie down immediately helps prevent a fall if they do lose consciousness and improves blood flow to the brain, potentially averting the faint. For example, if the MA ignored the warning signs and the patient fainted while sitting upright, they could sustain an injury. Always prioritize patient safety by getting them into a safe position, such as lying down, at the first sign of an impending faint. Question 17. A medical assistant is documenting a patient's vital signs and finds that the patient's respiratory rate is 28 breaths per minute. This finding should be documented as which of the following? A. Bradypnea. B. Tachypnea. C. Dyspnea. D. Apnea. Answer: B. Tachypnea. This question assesses the MA's understanding of medical terminology related to respiratory rates. The keyword 28 breaths per minute is significantly higher than the normal adult range, typically 12 to 20 breaths per minute. Tachypnea refers to an abnormally rapid breathing rate, which aligns with 28 breaths per minute. Bradypnea is an abnormally slow rate, dyspnea is difficult or labored breathing, and apnea is the absence of breathing. For instance, a patient with pneumonia might exhibit tachypnea as their body tries to compensate for reduced oxygen intake. Always remember that tachy- indicates fast, and knee relates to breathing. Question 18. A medical assistant is performing venipuncture. The patient pulls their arm away sharply, and the MA is stuck by the contaminated needle. What is the immediate first action the MA should take? A. Clean the puncture site with an alcohol wipe. B. Notify their supervisor after finishing the procedure. C. Milk the site and wash hands thoroughly with soap and water. D. Complete an incident report form immediately. Answer: C. Milk the site and wash hands thoroughly with soap and water. This question tests critical knowledge of post-exposure protocols for needlestick injuries, a vital component of workplace safety. The immediate concern after a needlestick with a contaminated needle is to minimize exposure. Milking the site, gently squeezing to encourage bleeding, and thoroughly washing with soap and water helps to flush out any potential pathogens. While reporting is crucial, the very first step is direct patient care for oneself to reduce infection risk, then reporting. For example, delaying washing to complete paperwork could increase the chance of pathogen entry. Always prioritize immediate wound care, such as milking and washing, after any sharps injury. Question 19. A medical assistant is preparing to clean an exam room after a procedure. The exam table has visible blood stains. Which of the following cleaning solutions should the MA use? A. Alcohol-based hand sanitizer. B. Soap and water. C. Quaternary ammonium compound wipes. D. 1. 10 bleach solution or EPA-registered disinfectant. Answer: D. 1. 10 bleach solution or EPA-registered disinfectant. This question focuses on infection control and proper environmental cleaning in a healthcare setting. The key phrase, visible bloodstains, indicates the presence of potentially infectious material, requiring a strong disinfectant. According to OSHA and CDC guidelines, surfaces contaminated with blood or body fluids must be cleaned with an EPA-registered disinfectant or a fresh 1,10 bleach solution to effectively kill pathogens like HIV, HBV, and HCV. For example, using only soap and water would clean the surface but not adequately disinfect it from bloodborne pathogens. Always use an appropriate EPA-registered disinfectant for cleaning blood-contaminated surfaces to ensure effective pathogen elimination. Question 20. A medical assistant is preparing to obtain a blood pressure reading from a patient. Which of the following actions by the MA could lead to a falsely low blood pressure reading? A. Using a blood pressure cuff that is too wide for the patient's arm. B. Reinflating the cuff immediately after the first reading. C. Having the patient's arm positioned below heart level. D. Taking the blood pressure after the patient has just exercised. Answer: A. Using a blood pressure cuff that is too wide for the patient's arm. This question tests critical details in vital sign measurement technique, specifically factors that can affect blood pressure accuracy. The keyword falsely low is the core of the question. A blood pressure cuff that is too wide will result in a falsely low reading because it distributes the pressure over a larger area, requiring less actual pressure to occlude the artery. Conversely, a cuff that is too narrow results in a falsely high reading. For example, if a standard adult cuff is used on a very thin arm, the reading might appear lower than the patient's true blood pressure. Always ensure the cuff size is appropriate for the patient's arm to get an accurate blood pressure reading. Question 21. A medical assistant is collecting a capillary blood sample for a glucose test. After performing the skin puncture, the MA notices the first drop of blood appears watery and mixed with tissue fluid. What is the most appropriate action? A. Collect this first drop to ensure enough sample. B. Discard the first drop and collect the subsequent drop. C. Squeeze the finger vigorously to obtain more blood. D. Use a different finger for the blood collection. Answer B. Discard the first drop and collect the subsequent drop. This question assesses proper technique for capillary blood collection, a common MA skill. The key observation is that the first drop of blood appears watery and mixed with tissue fluid. This first drop should always be wiped away because it contains tissue fluid that can dilute the sample and lead to inaccurate test results, especially for glucose. The second drop, which is purer blood, should then be collected. For example, if a patient's glucose level is tested using a diluted first drop, it might falsely appear lower than it actually is. Always wipe away the first drop of capillary blood to ensure the integrity and accuracy of the specimen. Question 22. A medical assistant is reviewing a patient's lab results. The results indicate a critically low potassium level, hypokalemia. Which of the following is the most immediate action the MA should take? A. Document the results in the patient's chart. B. Call the patient and advise them to increase potassium-rich foods. C. Notify the physician immediately. D. Schedule a follow-up appointment for the patient. Answer C. Notify the physician immediately. This question tests the MA's understanding of critical lab values and the urgency required for certain findings. The phrase, critically low potassium level, hypokalemia, is the crucial clue, as critically abnormal lab results require immediate attention from a provider. Hypokalemia can lead to serious cardiac arrhythmias and other life-threatening conditions, necessitating prompt medical intervention. For example, waiting to notify the doctor could put the patient at risk of a cardiac event. Always prioritize immediate communication with the physician for any critical lab values to ensure timely patient care. Question 23. A medical assistant is performing a venipuncture on a patient, and the patient reports a sudden, sharp, radiating pain down their arm. What is the MA's immediate course of action? A. Reassure the patient and continue with the draw. B. Withdraw the needle immediately. C. Adjust the needle position slightly. D. Ask the patient to clench and unclench their fist. Answer B. Withdraw the needle immediately. This question assesses crucial patient safety protocols during venipuncture, specifically recognizing and responding to nerve injury. The keywords sudden, sharp, radiating pain are classic signs of nerve involvement during venipuncture. If a nerve is hit, the immediate and safest action is to withdraw the needle completely to prevent further damage. Adjusting the needle could worsen the injury, and continuing the draw is unacceptable. For instance, continuing the draw could lead to permanent nerve damage. Always withdraw the needle immediately if a patient reports sharp, radiating pain during venipuncture. Question 24. A medical assistant receives a phone call from a patient who is very upset and demanding to know why their prescription was not called in. The MA determines the prescription was sent but to the wrong pharmacy due to a transcription error. What is the most appropriate response for the MA? A. The doctor forgot to send it in, but I'll remind him. B. It's not my fault, the computer system messed up. C. I apologize for the inconvenience. Let me contact your correct pharmacy immediately and ensure it's sent over. D. You need to calm down, we'll fix it when we have time. Answer C. I apologize for the inconvenience. Let me contact your correct pharmacy immediately and ensure it's sent over. This question tests communication skills, patient de-escalation, and problem-solving in a real-world administrative scenario. The core concept is professional and empathetic communication, especially when an error has occurred. Taking responsibility, apologizing sincerely, and offering an immediate solution is the most appropriate way to handle an upset patient and rectify an error. Blaming others, being defensive or dismissive will only exacerbate the patient's frustration. For example, a simple, direct apology and immediate action to resolve the issue can turn a negative experience into a positive one for the patient. Always apologize for errors and take swift action to resolve the problem for the patient. Question 25. A medical assistant is asked to perform a rapid strep test. After collecting the throat swab, the MA adds the reagents and waits the specified time. The result shows two lines, one at the control, C, region and one at the test, T, region. How should the MA interpret this result? A. Negative. B. Positive. C. Invalid. D. Inconclusive. Answer, B. Positive. This question assesses the MA's ability to accurately interpret common point-of-care laboratory tests. The key detail is the appearance of two lines, one at the control, C, region and one at the test, T, region. For most rapid diagnostic tests, including rapid strep, the presence of a line at both the control, C, and test, T, regions indicates a positive result, meaning the targeted pathogen, in this case, Streptococcus, is present. A single line at the control region indicates a negative result, while no control line or only a test line indicates an invalid test. For example, similar test line interpretations apply to pregnancy tests. Always remember that for a rapid strep test, two lines mean a positive result.